عليكم طلاب. الجزء الثاني من محاضرة Hemodynamic disturbance راح ناخذ two subjects, important subject هو embolism and shock. The first subject is embolism, defined as a detached intravascular mass that is carried by blood to a site distant from its point of origin. The mass was maybe solid, liquid or gaseous. هنا عندنا الامبوليزم it's a detached, so it's a circulating moving mass, the most important to decide distance from its point of origin. 99% of all emboli is a part of a thrombi, so the majority usually result from a detached thrombus. However, other causes of the embolism resulted from the either bone embolism, detached bony fragment, bone marrow emboli. Usually the second and third causes usually occur following fracture of the bone, resulting in the detachment and circulating in the blood to a site distant from its point of origin. Fat emboli also occur in the fracture of long bone. Air emboli, atherosclerotic emboli راح ناخدها بالموضوع الاتherosclerosis. Tumor emboli is detachment part of malignant tumor and circulate in the blood. Foreign body emboli such as bullet. الفكرة من هذه إنه the majority of the embolism resulted from it's a part of thromboemboli. Pulmonary thromboembolism. This means thromboembolism يعني embolism originate from a thrombus, usually present at any point within the pulmonary circulation. 95% of cases the thrombi originate from the emboli originate from thrombi within vein in the lower extremities. So the majority of cases, the origin from thrombus present in the veins of the lower extremities, detached and moved in the circulation and become lodged within at any point within the pulmonary circulation. Maybe in the main pulmonary trunk, maybe across the bifurcation of the pulmonary artery called saddle embolus, or in the main pulmonary artery, or in the medium-sized branches of pulmonary artery, or even in the small peripheral artery and arteriolar branches. This is the gross picture during the post-mortem examination and after death dissection, and reveal the causes of the death was sudden embolus. Sudden embolus means large embolus at the bifurcation main pulmonary tract and its bifurcation causing sudden death. The outcome of pulmonary embolism. You should know that 60 to 80% of all pulmonary embolism are clinically silent because they are small and undergo organization with time and become incorporated into the vascular wall. مثل الفيت of thrombi. one fate of thrombus لما تكون organization mean a growth of the macrophage. هذه الماكروفاج تسوي digestion للثرومبس and recanalization. new canal مثل الثقوب راح تكون inside thrombus. هذه responsible for maintenance of the blood flow and prevent obstruction. Then so it's pass and become clinically silent, asymptomatic. Sudden death or right ventricular failure corpulmonale occurred when 60% or more of the pulmonary circulation is obstructed. This is mean if either large thrombus such as the saddle embolus, large embolus such as saddle embolus, or when 60% or more of the pulmonary circulation is obstructed. Corpulmonale mean right-sided ventricular failure secondary to the pulmonary disease as pulmonary embolism. Pulmonary hemorrhage when obstruction of the medium-sized artery may result in pulmonary hemorrhage. This is due to the blood flow into the area from intact bronchial circulation. لما medium size only pulmonary artery only obstructed, another branches usually remain patent, so resulting in the pulmonary hemorrhage. Pulmonary infarction occurs when small size pulmonary artery or arteriole is occluded, resulting in the infarction, death of pulmonary tissue supplied by that branch, or pulmonary hypertension Systemic thromboembolism. In 90% of cases, it arises from cardiac mural thrombi. As we mentioned previously, cardiac mural thrombi mean thrombus that occurred or attached to the cardiac chamber. So the origin in majority of cases from the cardiac mural thrombi. The rest of the emboli, represent 20%, may arise from or associated with ulcerated atheromatocyclic or aortic aneurysm. The most common causes هو of systemic thromboembolism هو cardiac mural thrombi. The second other and third other causes هو ulcerated atheromatocyclic or aortic aneurysm. هذه مواضيع احنا ناخذها بالمحاضرات القادمة. The major sites for lodging are lower extremity, represent 75%, the brain 10%, and lesser extent intestine, kidney, and spleen. هنا نلاحظ الفرق بين pulmonary embolism و systemic thromboembolism. Pulmonary embolism, the majority of cases resulting from the thrombus in the veins of the lower extremity, while the majority of cases in systemic thromboembolism resulting from the cardiac mural thrombi. هنا pulmonary thromboembolism mean there is an emboli that lodge in at any point within the pulmonary circulation. هنا systemic thromboemboli, any part of the systemic circulation, not pulmonary circulation, systemic circulation. However, the majority in the lodging in the lower extremity. The consequence of systemic embolization depend on معناها الفate or outcome of systemic embolization يعتمد على 3 عوامل. A presence of collateral blood supply. إذا area هي rich in the collateral blood supply عادة يكون ال effect of the systemic embolism أقل من ال area اللي هي blood supply عندها أقل. Tissue vulnerability to ischemia. Some tissue more vulnerable to ischemia than other tissue in the body or other organ in the body. The size of the embolus عادة يتناسب طرديا مع السايز. كلما أكبر كلما produce the more symptoms and be more serious. The second subject is shock. The term shock refers to widespread hypoperfusion of cell and tissue of the body. Hypoperfusion mean perfusion of the blood to that cell, the cell of tissue of the body. The causes of hyperperfusion either decrease in blood volume itself, لأن blood volume من يقل راح perfusion accordingly أيضا تقل, or decrease in cardiac output. هو منه اللي يضخ البلاد لأجزاء الجسم مختلفة هو الهارت. فمن تقل الكاردياك output راح يقل البرفيوجن. شوفون يعني المين باثوفيسيولوجي هو hypoperfusion. راح يقل البرفيوجن of the blood للcell and tissue of the body resulting in shock, or redistribution of the blood within the microcirculation causing insufficiency. عادة normally blood distribute in the microcirculation, preventing and usually sufficiently distributed in the microcirculation. If there is any factor that cause a redistribution of the blood resulting in shock. فأرجع أكرر المين pathophysiologic mechanism of shock هو hypo-perfusion of cell and tissue of the body. There are 5 categories of shock: cardiogenic shock, hypovolemic shock, neurogenic shock, anaphylactic shock. Each categories has an underlying cause or pathophysiology. The cardiogenic shock results from myocardial failure. myocardial failure يقلل الكاردياك output فيقلل perfusion of blood to the cell and tissue of the body, resulting in shock. Hypovolemic shock, which is actually the most common cause of shock, result from loss of blood or plasma volume. من يقلل blood والplasma volume راح يقلل perfusion, causing hypoperfusion of blood in cells and tissue of the body. Neurogenic shock is less common type, occur in anesthetic accidents or spinal cord injury. من اسمها neurogenic spinal cord injury anesthesia due to loss of the vascular tone. vascular tone هو اللي cause distribution of the blood sufficiently tissues and cell and tissue of the body. Mean there is a loss of vascular tone causing a redistribution and insufficient distribution of the blood, causing hypoperfusion and causing shock. Anaphylactic shock is a generalized IgE-mediated hypersensitivity reaction associated with systemic vasodilation and increase in vascular permeability. Systemic vasodilation and increasing vascular permeability result from IgE, mast cell, and mediator. This is causing sudden decrease in circulating blood volume and tissue perfusion. هذه اللي ال5 categories of shock. طبعا هي مهمة. كل categories إلها underlying cause، يعني خليتها بالأحمر حتى تحفظوها وتعرفوها. وهذه ال underlying cause كلها تؤدي إلى شنو؟ underlying pathogenesis. The main underlying pathogenesis of shock اللي هو hypoperfusion of cell and tissue of the body. Now, septic shock is a type of shock, as an important type of shock. It results from vasodilation and peripheral pooling of blood as part of systemic immune reaction to bacteria or fungal infection. من اسمها septic shock means there is an infection. هذه infection produce a systemic inflammatory response syndrome لهذه infection and release of mediators. هذه الميدياترز تسوي لنا vasodilation and peripheral pooling of the blood. هذه الفازودايليتيشن بالنهاية ايش راح تسوي؟ حيقللنا البلاد فوليوم، وش راح بعدين تسوي؟ hypoperfusion اللي هي the main underlying pathogenic mechanism of shock. It has a mortality rate of near 20% and it's considered as the first among the causes of death in an intensive care unit. Currently, septic shock is most frequently triggered by gram-positive bacterial infection, followed by gram-negative bacteria and fungi. Hence, the old name of endotoxic shock is not appropriate. The term systemic inflammatory response syndrome اللي قلنا هذا response of the body to infection. قلنا septic shock here result from infection from the terms septic. Infection produce a systemic inflammatory response syndrome. من اكو systemic inflammatory response syndrome with a suspected source of infection راح نسمي الcondition termed sepsis. Sepsis mean infection with a systemic inflammatory response syndrome in response to the infection as a body defense mechanism to infection. هذه sepsis with one or more end organ failure is called severe sepsis. فلما تكون infection و systemic inflammatory response syndrome زائد one or more end organ failure راح تكون severe sepsis. Sepsis with hemodynamic instability is called septic shock. فهنا septic shock هي sepsis with hemodynamic instability. لهذا السبب احنا الشوك هي it's actually shock is an hemodynamic instability. فمن بتكون وياها sepsis the term راح يكون septic shock. هنا السيستميك inflammatory response syndrome هي المسؤولة عن majority of the symptoms of shock. It's a complex pathophysiologic response to an insult. It's an any insult يعني أي مؤثر خارجي. Manifest as an endothelial cell injury and activation. Release of inflammatory mediator اللي هي مسؤولة عن symptoms and pathogenesis of shock, and increase the metabolic rate of tissue, so need more oxygen. نانا microorganism suspected or proven infection فراح يصير diffuse endothelium disruption and impaired microvascular function. Systemic inflammatory response syndrome تعطينا severe sepsis with organ dysfunction. احنا قلنا اذا هذه الحالة انه فقط الانفكشن ويا systemic inflammatory response قلنا the term sepsis, لكن with one or more end organ failure راح تكون severe sepsis. Severe sepsis or sepsis with hemodynamic instability راح يكون septic shock اللي هي طبعا manifested clinically. هذه only clinical راح تاخذوها بمحاضرات الكلينيكال. hypotension, hypoxemia, oliguria, metabolic acidosis and thrombocytopenia. Stages of shock. You should know that shock is not a static condition, it's a progressive condition. Deterioration of circulation in shock is a progressive, continuous phenomenon and compensatory mechanism become progressively less effective. Normally in the body there is a compensatory mechanism as in edema. Also it's a compensatory mechanism that prevent shock formation. When this compensatory mechanism fail to overcome the condition, resulting in the deterioration of the shock. So we have three stages. The first is a non-progressive initial compensated reversible shock. At this stage, the shock is reversible when rapid action occurred, so resulting in the retention of the normal hemodynamic resulting in the normal hemodynamic state of the body. Progressive is a decompensated shock when compensatory mechanism fail to overcome the condition. Decompensated is a irreversible shock. بهذه المرحلة there is an irreversible event, and may be fatal. Shock is a syndrome that can occur in the course of many life-threatening traumatic condition or disease states. You should know that it's not a disease itself. It's a syndrome that occurs as a complication of many disease, many traumatic condition, many disease states, as a complication producing an hemodynamic instability and shock. هنا stages of shock مثل ما as mentioned previously. Initial non-progressive stage is a compensated stage when compensatory mechanisms work, during which less compensatory mechanisms are activated and perfusion to vital organ is maintained. هذه اللي many neurohormonal mechanism operate اللي احتقدوها أو بالفسلجة. It's a normal compensatory mechanism to prevent shock formation. Progressive shock هذه stage when it's a decompensated, when the compensatory mechanism is still act and overcome, so characterized by anaerobic glycolysis switch inside the cell from the aerobic to anaerobic glycolysis because of hypoxia. Hypoxia results from hypoperfusion of the blood. Lactic acidosis increase in the production of lactic acid and lowering of the pH inside the cell. Irreversible stage in which there is widespread irreversible cell injury and even correction of the hemodynamic disturbance will not stop, and deterioration of the cardiac output and metabolic acidosis. The reduction of the blood flow to vital organs such as brain, heart leads to ischemic necrosis and cell death. The cellular and tissue effects of shock are essentially those of hypoxic injury. Hypoxic injury. Why hypoxic injury? لأنه احنا قلنا the main underlying pathologic mechanism of shock هو الهايبوبرفيوجن. blood hypoperfusion لأنه من يقل البرفيوجن راح يقل الأكسجين supply to the tissue and cell of the body resulting in the hypoxic injury. لأنه عندنا many type of cellular injury من ضمنها type hypoxic injury occur in shock and are caused by combination of hypoperfusion and microvascular thrombosis. من يكون small thrombi within the microcirculation prevent flowing of the blood sufficiently to tissue and cell of the body, resulting in the hypoxic injury. Decrease in the oxygen supply of the blood to the cell and tissue of the body. Although any organ can be affected, brain, heart, kidney, adrenal and gastrointestinal tract are most commonly affected. Except for neuronal and cardiomyocyte loss, affected tissue can recover completely if the patient survive. After survival of the patient, usually recover an effect of shock on any organ can recover completely except when there is an injury to the neuron or cardiomyocyte. Thank you with best wishes.